start off, I'll introduce Mark. So as you know, this session is really done in collaboration with our Alumni Association. So Mark Venturi is the president of our MHA Alumni Association, and he'll be doing more of the moderating of everything. So I'll pass it over to you, Mark.
Thanks, Colin. Yeah, so I'm the current president of the MHA Alumni Association. I took the job and the pandemic started, so I really haven't done much, which is always interesting. And having asked those sort of in the space, there's not really a lot of willingness to do a lot right now because everybody in healthcare is so busy, which is very feasible. So we have started, we would like to implement a mentorship program as an adjunct to the current, all the current things that are great about the Telford program. So for those who are MHAs that are on here or future MHAs, please do go to check out if you go onto LinkedIn and it's the Telford MHA program. I'll put a link in the chat, but I'm not too sure if it's going to work. I'll give it a whirl. That's the LinkedIn group. We vet everybody in there. Those are the MHA. Everybody there is an MHA. We're trying to make that the new place for MHAs to be able to go and chat and share. And for those who are interested in participating in a mentorship program, please do keep track and sign up. And that's going to hopefully be the next big thing for the Alumni Association. The way to sort of keep in touch with the school as well as help out the next cohort of students. I think there's a lot going on in healthcare and a lot of change, as we're about to find out. And so being able to touch base with the latest students and seeing how the change is affecting them is going to be very, very important. So without any further ado, I'm going to hand it over to Kara. So please do type in questions for now. And then once her presentation is over, we'll be able to open the floor up. So please do stay muted during Kara's presentation. Thank you, everybody, and over to Kara.
Thanks, Mark, and thank you, Colin. And thank you to all of you today for joining today's session. And I'm honored to be here with you today and to be speaking on the topic around digital innovation, specifically around creating healthier lives for Canada. A little bit about me, maybe before we get into the presentation. Currently, I'm the Director of Digital Innovation at the Ottawa Hospital. I'm new to the hospital, and this is also a new role for the hospital. So I've been in my role for about 3 months. Although innovation has been very much a strategic objective for the hospital over the past couple years. Right just now, we are ready to now act upon it and start to develop our innovation program further. So maybe I'll explain a little bit what we're trying to create at the Ottawa Hospital in terms of our innovation program, and then I'll get into a bit around the presentation. So we're really trying to create something new and groundbreaking for the hospital and potentially for our people within Ottawa and our region. We're trying to develop an open innovation model in which there's 2 key aspects that we're focusing on. The first is innovation from within, and the second is innovation from outside. So innovation from within refers to supporting our physicians, clinicians, researchers, scientists with their innovative ideas or innovative solutions that they're trying to develop. We want to be able to support them and facilitate them through the innovation cycle, but also be able to help connect them to different third-party companies if needed to help make their product come to life. The second, around innovation from outside, this is focusing on partnerships from both the public and private perspective. The public side is more partnering with our universities, with our healthcare community providers, those types of organizations. The second is around partnering with startups and larger third-party companies to accelerate innovation in the digital space. So today I want to speak about how digital innovation will create healthier lives for the citizens of Ottawa, our region, and potentially across the world. So why digital innovation will create healthier lives? I want to start having you imagine a scenario here. So imagine a health system where every person receives the right care in the right space with the right provider. where a mix of virtual and in-person care perfectly complement each other. This new system would also be a model of distributed healthcare to improve communication between patients and providers, enable automated personal support and remote monitoring, and seamless integration of smart medical devices. The impact of digital innovation on our system will lead to a much better patient experience for patients and staff, enhance value in the system, and create better health outcomes for all people. You won't be surprised that I'm referring to the quadruple aim. Ultimately, digital innovation is for the patient. And while the COVID pandemic may have been a catalyst for the adoption of virtual care and digital technologies, we still have a lot of work to do before we achieve a digitally enabled health system. The future of health envisions timely, transparent, and high-quality care delivered in the right setting. Patients and providers of the future are going to benefit from tailored, personalized care, experiences driven by data sharing, public-private partnerships, and patient and provider-driven technologies. I'm going to focus on these three key areas today. So first, data gathering and sharing. Data is gold in healthcare, and data needs to be shared to make change happen. Now, you may think there's already a lot of data sharing that's happening across institutions, across hospitals, across providers, but it is the sharing of data that affects change that is important here. Excuse me. The second thing I want to focus on is bring the outside in. What I mean here is partnerships. Partnerships take shape with both public and private institutions, but currently partnerships exist with universities and community providers. So today, I want to hone in and focus on the private partnership perspective. Last, or not last, but third, patients and providers as co-designers. This is not just about getting greater patient and provider feedback during the innovation process. Patients and providers should be co-designers and co-developers in the process. And I want to dig a little deeper into each of these focus areas. So let me walk you through a common scenario that most hospitals face today. The ultimate goal in healthcare is the quadruple aim, which we already discussed earlier in the presentation. To affect change within each of the quadrants requires data to support operational monitoring and planning, innovation, and research. And this data is collected at the clinical operations level and is usually collected and stored in an unorganized, siloed, and inaccessible manner. To access this data requires a number of steps in terms of gathering, organization, de-identification, and ultimately analysis. This process of collecting, organizing, and de-identifying data can take anywhere from 2 to 6 months. Now, imagine you had a technology that could take your idea to improve straight to obtaining data to be able to query and analyze just in time in the moment. This can happen, and this technology is already in existence and in use around the world. So, as you can see, one of the #1 issues you will find most healthcare organizations experience is access to data. Data is in high demand and the appetite is only growing. But data needs to be gathered and shared in a format that is useful. Otherwise, you will not be able to affect change on your desired outcomes. I have to also note here, enabling high quality data analysis in a privacy protective way is a public good. So we also need to ensure that the utility and privacy of data complement each other so that there's no trade-off between the two. We need to get the privacy right, and it is a big hurdle that we need to manage through so that it can be shared without concern of breaching personal health information. This technology that has been developed in terms of being able to develop a data lake in which it can grab the data, organize, anonymize, and bring it to the provider at the touch of just a click of the mouse is a game changer for healthcare organizations and will play a big role in the digital innovation space. Let me take you through a quick example of the Ottawa Hospital. A few years ago, the hospital decided to implement a hospital-wide electronic medical record and partnered with a number of hospitals in the region, including the Heart Institute and family health teams, with the intention to share data with their common shared patients in the Ottawa region. The Ottawa Hospital Analytics team worked with the company implementing the EMR to understand the system and how data is stored within the electronic medical record. The Ottawa Hospital and its partners now have an immense amount of data being captured and stored, but it still requires a team and time to be able to access and use the data for meaningful change, research, and innovation. What the hospital does not have yet, and will be important, is this technology that generates the data and anonymizes it so that we'll be able to share within the region and across the world. Data that is accessible in a timely manner and that is shareable while protecting privacy will be a game changer for the innovation space. Now, whoops, going the wrong way. Now, data sharing with private sector or with partners is a whole new level of challenge. But I believe that if we do not form these partnerships, we will not realize the full potential and power of digital innovations. Partnerships will allow the exchange of skills, networks, access to resources, and information to achieve a common shared goal, which most namely is the quadruple aim. Now, as I noted earlier at the beginning of the presentation, I want to hone in here on the private partnership piece for today's presentation. Partnerships should be formed in an impactful way that maximizes the benefits for both parties while minimizing the risks. From a benefit perspective, it is improvement to services such as reducing costs and length of stay and improving the patient experience. From a risk perspective, it's ensuring you have done everything to mitigate against disclosure of confidential information and personal information and properly managing conflicts of interest. At the Ottawa Hospital, we're pursuing partnerships at the startup level and with pharma and medtech companies. These partnerships have allowed the hospital to test and pilot innovative solutions with our providers, patients, and staff. I'll provide a current example. We're currently partnering with a Canadian lighting company called Luminex that has developed an artificially intelligent monitoring system that measures hand hygiene compliance. Using advanced machine learning and algorithms, the device can determine if hand washing technique and duration is adherent to protocol and if hands remain sanitized prior to coming in contact or in close proximity to the patient. If the device identifies non-compliance, it will beep before the provider touches the patient. We're currently helping Luminex determine whether their technology works as intended and whether our providers find it supportive in hand hygiene. Should this technology be found to achieve the intended outcomes, the potential to improve hand hygiene and infection and prevention control will be of great benefit. Another example, and this comes from the international landscape, we're currently in partnership or discussing with a company in Israel called Seamless Vision. Seamless Vision is a startup company from Israel that has developed a fully autonomous micro-mobility platform powered by AI that enables seamless navigation in dense environments. It's essentially a device in which can navigate you through both indoor and outdoor environments without you having to see. The company would like to test its product in hospitals by supporting wayfinding and logistics deliveries across the hospital. The founder of Seamless Vision made his product based on his experience with his grandfather who was blind. He wanted to make it easier and seamless for the blind to be able to navigate its environment both indoors and outdoors. We are now exploring opportunities with this company to bring the device to Canada and test its utility at the hospital. And one final note here in terms of partnerships, not currently in existence at the Ottawa Hospital, but I feel has great potential in the future, is with wearables and personalized medicine. So we've already seen these products start to come to market, but it's definitely not at large scale. From the wearables front, they'll help form the basis to engage and encourage patients to lead a healthy lifestyle, where the provider can continuously track both health and wellness in real time and communicate with their patients outside of their appointments. I'm going to note here, I'm not an expert on personalized medicine. However, when it was first explained to me, it was in relation to a cancer patient and a cancer drug. In the not so distant past, if you had a certain cancer, you would get a certain drug. But the cancer doctors wondered why some patients got better and some did not with the same drug. When they studied the genetic makeup of the patient and the drug they used, they were able to see that the genetic makeup of the patient and the drug, and whether the drug would work or not with the individual. So it was totally personal in terms of whether the drug would work for that specific cancer. Anything that is used to treat and design for the specific patient is personalized medicine, and personalized medicine is the healthcare of the future. The last item I want to touch on here in terms of patients and providers as co-designers in innovation. So consumer expectations, regardless of age or industry, are higher now than ever. Consumers expect immediate gratification as they become accustomed to 24/7 access to personalized and on-demand services, whether it be ordering a pizza, calling a cab, or managing your finances online. As a result, patients' expectations regarding the healthcare experience are changing. The concept of human-centered design and co-creation is emerging worldwide, which is a set of approaches that can accelerate and humanize healthcare innovation. This model isn't just about getting greater patient feedback during the innovation process. Patients are co-designers, co-developers, and increasingly more responsible for their own and collective health outcomes. Equally important is the inclusion of providers in the innovation lifecycle to also inform, co-design, and co-develop the product or platform. Most often, the products or platforms are created to support the provider workflows. Therefore, their input and evaluation is necessary. Now, providers may also be the inventor or have an idea around an innovation solution. And in this respect, we want to be able to support these providers in their innovation development. At the Ottawa Hospital, we want to support our physicians, clinicians, researchers, and scientists to develop their own innovation solutions based on their experience and expertise. An example of this is we are currently supporting a physician at the Ottawa Hospital in piloting his product that uses continuous monitoring to predict when to extubate a patient. ICU patients must safely transition from ventilator to breathing on their own, but failed extubation harms patients and increases costs. This physician has developed a technology that provides enhanced prediction of extubation outcomes and assesses when a patient is ready for extubation. We are supporting this physician to get the necessary approvals at the hospital and scope the pilot so that he is able to test and evaluate his product. This is what we want to be able to do at the Ottawa Hospital. We want to be able to support more of these projects with our physicians, with our staff, with our people, because they have the great ideas in terms of improving healthcare. And I want to end here in terms of what outcomes do we expect. So by focusing on data gathering and sharing, the public-private partnerships, and patients and providers as co-designers in innovation, the expected outcomes include achievement of the quadruple aim, improved care for individuals, better population health, optimal value for money, an engaged and productive healthcare workforce. We will accelerate the development and use of digital technologies in the system. And ultimately, we will create healthier lives and healthier populations. Now, remember that health system I talked about earlier that allowed for the right care in the right setting with the right provider, that has the perfect mix of virtual and in-person care, and that uses automated personal support, remote monitoring, and smart medical devices. We may have some time to go before we achieve this health system, but it is within reach, and we need to keep pushing the envelope and the possibilities within the digital innovation space. I do believe that in time, we will make the shift to create healthier lives and providing quality healthcare when needed. So that's what I wanted to say today, and I wanted to leave some good time for Q&A. So I welcome the opportunity for a good discussion.
Thank you very much, Kara. That was wonderful. I was really excited to hear more about the I don't know if it's going to be a robot that walks people to their appointments. Having worked at the Ottawa Hospital, I don't know how many times I had to say wrong 6th floor, and I'll help you out to get where you need to go. So, very exciting things. I've learned some good stuff here today, and we promised some of the folks that signed up that we were going to ask some of the questions that they wrote in first. So I'm going to fire off a couple of those, and then we'll get to the questions that are being posed in here. Alternatively, you could also put your hand up, and you can talk directly. So the first question that was submitted online was, how do you integrate healthcare innovation with standard practice? So to capture and expand on those opportunities. And I think this person said that we still use the fax, which is, yeah, so there's a lot of people still use the fax, so that's kind of sad. But that's the question. So how do you actually get that to integrate and to stay? We've all heard about good technologies coming up and maybe even trying them. Oh, that was a good demo, and then it's gone.
Great question. There's a couple of things here. First, the support for innovation needs to come from the top. So there needs to be support from your executive team to say innovation is a priority, and we are going to work with and focus on innovation solutions within your hospital or your organization. Second, there is a bit of culture that plays to this. So you do need to create that culture internally to be able so from the clinical perspective, you get that engagement, and there's the willingness and the want to try something new and to see if we can improve. I will note this is definitely a challenge we are experiencing at the Ottawa Hospital. Obviously, innovation really coming into practice is new for us at the hospital. And so working with our clinical teams is extremely important in terms of gathering their engagement and also talking to them about their willingness to improve and support a specific new innovation solution. So before we partner with a company, before we bring in a new solution, before we work with a clinical team, we always engage the leader of that clinical team first to identify, is this really a need within your clinical area? Is this a challenge? Is this something you want to work on? Before we actually bring that company in. So before partnering, before working on those innovation solutions, we do have a bit of a criteria that needs to be assessed and satisfied before moving forward. You won't be able to do it in a day. It's going to take time. So my advice or feedback is to keep working on it, keep bringing forward what you can achieve, what the outcomes may be. But there is a bit of change management involved with innovation. And so you very much have to focus on that piece as well.
Perfect. Thank you. The next one should be interesting. So how should an up and coming company go about getting the attention of large institutions like hospitals and introduce their innovative products and services to the right person?
Great question. So a couple thoughts on this one. First, I think you need to do a bit of research to understand, is the partner or the hospital that you're looking to address, are they ready? So there's a lot of times where we'll have companies come forward, say we have this cool product, we have this new innovative idea, we want to test it out, we want to work with you, we think we can get great outcomes and achieve great benefits from this. Unfortunately, either the hospital isn't ready for it, they don't have the structure in place to do it, and it ends up being a lot of kind of initial engagement, but then the idea ends up fizzling because there's just not that support to be able to do it internally. I will say most hospitals and healthcare organizations are now getting to the point where they are ready to engage with companies for meaningful kind of relationship and meaningful ways to partner on innovative ideas. So first, do your bit of homework, check out a bit about that organization and who you're dealing with. The second is look to see if they have an innovation program in place, who might be in charge. Obviously at the Ottawa Hospital, like I've been the new contact for the last 3 months. And so before that, we would get ideas and they would kind of either make it to the surface or not. So you need to find who that right contact is. Look at the networks that are happening across the healthcare system right now. There's Healthcare Can, there's Obio, there's a bunch of networks that are popping up from the innovation perspective, which can also give you good insights and understanding on the types of organizations that are focusing on innovation and the types of products that they're looking for in terms of improvement with their organizations.
Thanks, Kara. Anita, you feel free to unmute yourself. You can ask your question or your hands up.
Hi, thanks
Hi.
very much, Mark. I appreciate it. Kara, thanks for the presentation. Just to provide context, I myself work in the pharmaceutical industry, currently work in patient engagement and policy strategy in the industry. And one of the questions I had, just having been in the oncology space and very clear on what Ottawa is trying to do, I'm curious to know, Ottawa was one of the first hospitals to start with Epic. And so I'm just curious as to what your approach is in terms of digital innovation to incorporate some of the things that you're doing within that Epic system, because I know there's a lot of hospitals across Canada that are slowly moving towards that. You know, and the big fun, we always say it's been an epic opportunity to try and improve that space. So wondering if you could comment on that, and if I'm lucky, I have one other question, but we can start with that one, please.
For sure. Yes, so great question. In terms of Epic, so as I noted, the Ottawa Hospital has spent a lot of time, a lot of resources, a lot of budget getting Epic into the hospital. And we do have an Epic first strategy when it comes to digital innovation. So if we have a provider or a researcher or a scientist that has an idea in terms of improvements within the EMR, we work with within the Epic team to see if there's a possibility to make that happen within Epic. So we have a team that's working on enhancements and improvements within Epic based on physicians' clinical workflows, patient engagement, and helping with real-time decision-making as part of clinical practice. If we find that Epic just doesn't have the capability or not able to build it, then we will look for a digital solution that would be an add-on to Epic to help support that. As you can imagine, from our IT department's perspective, we don't want to start to have an EMR that has a bunch of add-ons instead of looking at the full spectrum of what Epic can offer. So that's our strategy in terms of Epic. Now, I will note as part of our Epic implementation, as I noted, we implemented in partnership with a bunch of hospitals within the region, with the Heart Institute, with some family health teams. And so we formed what we've called an alliance. And so that table with representatives from each of those organizations make the decision in terms of the improvements that will be put forward to Epic. So it really is kind of a collaboration in terms of how we're making those improvements to Epic. And it really is the intent to make sure that it's not just an improvement for the Ottawa Hospital, it needs to be improvement that it supports our whole patient population across the Ottawa region.
Thanks, Kara. I have a question from Sandra here. Is the hospital ready? I'm going to add my own personal willing and able. So is the hospital ready to create a hub for innovation open to members of the community and patients?
We are on our way there. So that is very much in our plans. As I noted earlier, from our physician perspective and both from our partnerships with our universities and healthcare providers and with the private partnerships, we want to be an incubator. We want to be a living lab. The Ottawa Hospital wants to be a place where these people can come to test, pilot, and do proof of concepts. So Hub for Innovation, we don't have it yet, but it is coming in the very near future.
There's a second part to the question, which was, how would you deal if a leader is not open to the innovation?
So I'm going to be very honest here. You can't force it. Engagement is key in terms of seeing the expected benefits and outcomes from what you are trying to achieve. If the leader is not ready, I would hold off on it for a bit and then work on them. Bring forward what you see the expected outcomes, benefits. You also need to potentially build the case for it. So help them understand the expected outcomes or benefits you can achieve from the solution and why it may help improve either their workflow, clinical practice, or improve the patient experience. But in my experience, if you don't have the leadership and engagement of that clinical leader, it's not worth trying to force it in.
Kara. Craig, would you like to unmute yourself? Craig,
sure. All right, thank you. Hopefully you can hear me okay. My question might be a repeat of what's already been asked. It's about alliances and is there any plans to work with other institutions across the province for that interchange of data, information, best practices, or even locally with family practices into the hospital and having it seamless? Because as a patient from time to time, you're always repeating the same story over and over, and it just seems like from department to department and clinic to clinic, you're always in that repetitive mode.
Absolutely. So that is our one of our long-term goals to achieve. And I will say we are focusing first within Ottawa and then the Ottawa region, because we know that our patients travel across the region to seek care in various points of contact throughout the healthcare system within our region. So yes, timeline is probably longer term, just given what it involves to get there. But that is our ultimate dream. Our ultimate dream is if we had that technology, we could have a primary care provider in Renfrew tap into the data system from his patient who recently had a visit at the Ottawa Hospital, be able to see everything that happened, or even have provider to provider communication that happens within that technology, so that providers are also communicating with each other about their patient and their recent kind of medical visits.
We have another question actually coming from Colin. So the public's generally suspicious, or at least they can be suspicious of private-public partnerships. So how does an organization like the Ottawa Hospital demonstrate that this quadruple aim is actually being delivered through these partnerships?
It's a great question, and definitely a concern that we've had discussions at our executive table and with our board. So as part of the Ottawa Hospital, first and foremost, we need to ensure the partner who we are looking to either collaborate or form a partnership with actually checks off a set of selection criteria. Most namely, the number one is, does this company's values, mission, and vision align with the Ottawa Hospital? And are they ultimately trying to achieve the quadruple aim with us? Because that is our goal and our intent. When it comes to forming the partnerships, one of our guiding principles is transparency. So we are going to be very transparent around the partnership. We will inform our patients, we will inform our providers, and have them as part of that partnership so that they are along the process and able to inform in terms of what we are doing with this partnership and how it is going to achieve better outcomes for the Ottawa Hospital and achieve better outcomes for the people in Ottawa and the people within our region, and hopefully our people across Canada, should we develop something really great and innovative with that company. So transparency is key, being open and honest about it, and making sure that we actually have an alignment with that company and that the outcomes that we set out to achieve are open and honest with everyone.
Perfect. Well, there's no questions, but I have one for you, Kara. So just before everybody goes, but is there anything, technology coming on the horizon that frankly makes you nervous?
That's a great question. I'm going to say no, and mainly because I'm open to any and all technology, but it's really the intended use that we need to make sure it's used for what it was actually intended for. So as long as we stick true to being very clear on what our goals and our objectives are and the intended use, then I'm not scared of anything that's coming down in the future, but I'm actually very hopeful for what lies ahead for our healthcare system.
Perfect. Well, then the reverse of that question: what gets you the most? What's most exciting that's coming?
On a personal note, it's definitely the wearables and personalized medicine piece. I'm one of those kind of healthy, well people that tracks everything on my Apple Watch just out of curiosity, and I want to know how I'm doing and that type of stuff. So that stuff to me, on a personal note, I find very cool. The whole personalized medicine piece, where you're actually personalizing either drug therapy or being able to earlier predict and prevent certain diseases that you may be susceptible as an individual, I think is incredibly cool and incredibly huge benefits for the health system.
Well, if there's no other questions, I'm just going to get the thank you to everybody, including Kara. Thank you to all the participants today. I was posted by Colin in the chat. Please do check it out. That there's a survey to be filled out. We would love if everybody could take a few minutes and fill that out. The 4 recordings will be available in the next few days. And finally, as we wrap up, I would just like to say I am actually very excited about this Telfer's vision for a new, better Canada. And school's been really building upon a 50-year tradition of developing business leaders who are building a better Canada. That includes you, me, Kara. And I'm also excited by the Mr. Ian Telfer's matching donation opportunity. So do please check out the Telfer donation page and support the Telfer National Fund or the Better Canada Fund. So thank you, everybody, for participating. Here, there's the last comment up. And if there is nothing else, I believe that's it for today. So thank you very much, everybody.
Thank you.